with Obamacare about a couple of months away from taking full effect, there's actually some good news out of a new survey. Now, a Duke University CFO magazine poll of about 530 CFOs, which are chief financial officers at large corporations, right? U.S.-based companies revealed that actually they plan on increasing the number of full-time employees by about 2%. Okay, so kind of good news, kind of not, because it's good news that they're increasing full-time employment, right? It's bad news they're only doing it by 2%. So very tiny fraction of growth. But for now, I'll take it, I guess. And this is contrary to conservative talking points about how, man, that Obamacare, it's going to kill jobs. It's killing jobs. It's killing jobs. You know, there's going to be no more full-time jobs. They're all going to scale back because of, you know, the Obamacare, the fees. It's just going to destroy all of our businesses, right? Well, I guess not so much. In fact, corporations plan on doing pretty well in 2014 after Obamacare takes effect. In the next year, corporate profits are expected to increase by about 13%. Not too bad, especially considering that corporations are making the most money that they have ever. According to the article that I read this in, even with numerous risks and uncertainties affecting the global economy, U.S. firms have been able to protect the bottom line, operating at near record profit levels. All right. Another trend that is affecting the growth in domestic employment is the hiring by U.S.-based companies of full-time employees in foreign countries. Okay, so that's where your jobs are going. So more than 1 in 4 U.S. CFOs say their firms have hired full-time employees in other countries, and that number is expected to accelerate. So I don't know if I would really tie that to Obamacare, but this is what's happening to your jobs. They're hiring people in other countries.
I have to say, I mean, from where I sit, it all sounds ridiculous. All this fear-mongering that goes on about this. First off, the idea that jobs are leaving the country because of this, I find complete wash. This is just fear-mongering tactics, because those
jobs
people
were leaving America way before Obamacare.
Well, and
absolutely. There's no
room
for indication.
Well, these employers who are giving these jobs or sending these jobs to foreign lands would have been doing it regardless of Obamacare or the Affordable Care Act. And here's kind of the thing. I mean, you're talking to somebody now who lives in a country that's had socialized medicine, universal health care, government health care since before I was born. You look throughout
So
Europe,
where's your death panels?
You look throughout Europe, and all these countries have socialized universal health care. And the same thing, all these fears that the right wing and the Republicans and these anti-Obamacare people are putting into people's heads just don't happen. It doesn't happen here. It doesn't happen in Europe. Any of the jobs that are outsourced to foreign lands are jobs that are going to be outsourced anyways. It's not because of healthcare.
Right, exactly. In fact, I want to throw some more facts at you. More than 9 out of 10 businesses subject to the law already offer health insurance. They already offer health coverage. So to say that, oh man, we're gonna leave, we're gonna cut jobs, we're gonna cut your hours, we're gonna go overseas because of Obamacare, 9 out of 10 of those companies already offer their health insurance, and it's actually going to help the company.
Right. I would think that that the results would actually save the company money and make the cost of them giving health care to their employees go down in most cases.
And another fallacy that's already been disproved, and I'm not even talking about from other countries, but within the U.S. it's already been proved that companies who say, oh, if we give out this healthcare, we're going to have to put the cost on to the consumer, and your burger is going to cost another 10 cents. And that's complete fallacy too. It doesn't. And even if it did, is paying 10 cents more for a burger not worth everybody in the country being healthier? Forgive the idea of having it with a burger, but you know what I mean.
But yeah, I know what you mean.
Socialist.
Paying like 10 cents or less per item of whatever merchandise you happen to be buying in order to support someone actually being able to work a full-time job and support all of their bills and have, money at the end of their month. It's worth it.
I'd love to go after Papa John's Pizza, owner John Schnatter. Okay, the guy lives in a fucking castle.
With a moat. And a drawbridge.
And a drawbridge. Well, of course you have to have the drawbridge for the moat. How else are you supposed to keep out those unwashed masses? How are you supposed to keep the plebs out?
He was the one who said he was going to start firing employees if
for sure.
Okay.
Do you know how much? Do you know how much it would actually cost for him? And this is to keep at his current compensation level. 14 cents a pizza to offer health care to all of his employees.
Oh, his business is fucked.
14 cents a pizza.
That's it. I'm not buying a pizza if they cost that much. Holy crap.
14 cents extra. I know. Like
$7.50 instead of $7.40. Oh.
Look, and I've had Papa John's pizza. It tastes like ass anyway, so.
Well, I don't begrudge him for the stuff he has. As a matter of fact, if I had that much money, I'd have a castle with a moat around it and a drawbridge, and I'd have
and even,
probably
you have all that
crossbows
stuff,
on top.
But then you give your employees a living wage. Yeah, you can have all that stuff. He doesn't even need to pass on the cost of giving health care to his employees to the customers. He's just doing that because he's a greedy asshole. It's fine to have a moat and a castle and whatnot and all that, but if you can afford that shit, you give your employees a living wage, goddammit.
For sure.
Yeah, I don't see how being under a living wage helps the country at all. That argument is complete fallacy. I mean, you paying a living wage, there's absolutely nothing wrong with that, because if not, everything gets subsidized anyway. Now, what I find a real problem with is claiming that healthcare is going to be a reason for dismissal, and it's not. I mean, clearly the numbers don't back that up, and neither does the economic science of it. It just doesn't back it up. It's just a fake talking point. But when you say something that sounds like it's common sense, people get attached to that. I mean, I had somebody actually ask. Jeff joked about death panels a while ago, and I actually had somebody I know ask me, "Well, what are you going to think about the death panels?" And they were totally serious. They totally believed that was real. They didn't even understand that it was a fallacy, completely made up, and that a politician couldn't say that if it was just a complete fallacy on the floor. Could they?
Politicians
yes, of course they can. This isn't socialist Canada.
Well, it's the same argument they go to when people propose that we raise the minimum wage to anything, $9, $11, $15. It doesn't matter. Every time we propose it, the same argument comes, to the floor, which is, employees will start firing or cutting back on their employees and not hiring people because they won't be able to afford the wages.
I know, and it's simply untrue because the money just goes straight back into the system. I mean, it doesn't really affect anything. The only thing it does is makes a much more efficient use of the taxes that are paid. That's the only thing that it does.
And
the death panels are something that is more likely to happen without Obamacare and without any kind of national health care system, because
they're what's happening
now. Yes, it's what's happening
Your
now.
insurance company is a death panel because before certain provisions kicked in Obamacare, they could literally, if you get sick, they could yank your coverage. I believe that we read a story probably a couple of weeks ago where there was a small amount that they, undercharged or overcharged. There was something off on the finances, and the person got cancer. And they went and looked through that. They went and looked through the history and everything and saw that little mistake. It was like something like 97 cents. And they're like, yank their health care, drop them.
Oh, no. Yeah, they find any excuse that they can to save the company money, and the healthcare insurance worker that saves the company the most money by denying the most care is the one most likely to get promoted and get, the bonuses and be rewarded for taking healthcare away from people and causing people to die.
And so there's your death panel.